A very common question is, how am I going to feel after the procedure? Sometimes we feel really pretty good right after the procedure. We don't feel a lot of discomfort when we're in the recovery room. We have a lot of medications that offset any discomfort. So then the patients go home, and what happens after that? Well, really, really important is this. We manage the discomfort. That is to say, medications that are pain relievers, maybe even muscle relaxers, and various other things, ice, heat, warmth, even distraction like watching TV or other things, music. There's lots of things to do to help patients remain comfortable during those first hours of that night. Very important to me is that patients stay on a scheduled medication throughout the night. I often tell them to set their alarm every 3 to 4 hours to wake them up so that they can take a pain medication that relieves their discomfort. And often they say, I wake up, I don't really have discomfort, but I still take the medication because it keeps patients pain-free through the night instead of waiting until 5 a.m. to wake up in discomfort. The patients get through that first night. Oftentimes they're quite surprised that their discomfort level is very minimal, and I want them up moving. So as they get up and move around the next morning, they have a mild amount of soreness, but still as they go through it and they take their pain relieving medications, they're able to function and take a shower and make food for themselves and get drinks and even take a walk, maybe outside to get some fresh air, even to go to the mailbox to get their mail. Generally just get into their activities of daily living, managing their discomfort. As the next several days go by, there's a need for less and less of these medications, less and less interventions needed to help keep them comfortable. And generally speaking, patients within those first 5 days are up moving around. One of the most common questions I get is, Doctor, how long is it going to take for me to stand up straight? Because when we pull that extra skin tight, sometimes they feel a little hunched over. On average, it's about 5 to 7 days. It feels tight, but it's very natural for the patients to stand up and put a little bit of resistance against it. Nothing bad is going to happen, and they generally will stretch that to the normal standing position without any problems at all. I think the last question I get all the time is, well, doctor, am I going to have to wait 6 weeks to go back to work? And I'll tell you this, I can go back many, many years in thousands of cases. I just don't have patients that take 6 weeks off of work. Now, I will tell you the most average amount of time off of work for a standard tummy tuck without any extra types of procedures associated with it is typically a 1 week type of stretch. Patients may have a procedure on a Monday and they go back to work on a Monday. Sometimes patients will do a procedure on a Friday and take advantage of the weekend and go back to work the following Monday, which gives them a little bit like a 10-day stretch, and that's okay too. The most common thing that people experience is not discomfort actually. It is tiredness. Now, your body is actually going to use a lot of calories and a lot of energy to heal. So oftentimes patients at 2 and 3 in the afternoon, even if they're at work, they say they feel tired. And I always remind patients this, you have to eat, drink, and keep your body nourished. It's using a lot of energy to get yourself repaired and healed, so we need to keep pace with that. When we do that, the patients do feel much better and they have more energy.